Good morning, everyone. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be helping you pass the Medication Aide examination, or as others call it, the Med Tech examination. As we do in all of our videos, we give you about 10 seconds to receive your notifications, and we will get started shortly. And good morning, everybody. All right, so what is a medication aide? A medication aide or a med aide is a healthcare professional who assists licensed nurses in administering medications to patients in long term care facilities, assisted living facilities, and other healthcare settings. They do not perform full nursing duties, but focus on safe and effective medication administration. The general requirements are subject to the state that you live in. Usually, the education is a high school diploma or a GED, a CNA license, usually with 1 year of experience. Training hours, depending on your state, it can be 60 up to 140 hours of coursework, but it's not like you're going to a college in order to be a medication aid provider. You would be going to a small training facility. The certification examination is given in-house, and you must pass a written test. In addition, you have to do a skills pass. They're going to watch you as you're giving out medications. And if you can give out medication safely, you will become a medication aid provider. Okay, so what types of medications are you able to actually administer? Oral, topical, eye drops, ear drops, and inhalants. Notice what is not listed there. Injectables and or enteral medications, such as if you were administering a medication via a peg tube or a gastric tube, and also rectal medications. Understanding the different medications, this is really important. So as a nurse, it is hard to teach the med aid course because I am teaching laypersons, those who usually don't have a lot of medical experience, and CNAs, how to give medications, talking about the different classifications of medications, the side effects of medications, and on top of that, requiring you all to fill out a medication administration record or a MAR without making any mistakes. So the class is not an easy class to teach, but a lot of you all are successful. And the med aides in our state are making more than $20 an hour. And I'm in the state of Florida. And so that's with a CNA license. So understanding medications, you have to understand the classifications, the side effects, the interactions. You do have to do some medical math. So you have to understand dosage calculation, but just basic math, and you can utilize a calculator. What are your core skills that you're going to be tested on? Let's talk about the legal and ethical responsibilities. Of course, the basics. We have HIPAA, patient privacy, proper documentation, recognizing the scope of your practice. Are you going to be administering an intramuscular vaccine? No, you're a med aide. That's the nurse's job. Safety precautions, infection control measures, avoiding medication errors, and of course, communication, because those patients, they're going to have to build trust. They're going to have to build trust because it's like, hey, yesterday you were a CNA. Today you're giving me my medications, and I know you didn't go to nursing school. So the way that your demeanor, your professionalism is going to matter so much. And then let's talk about those state variations. Some states call medication aides by different titles, such as med tech or medication technician. In the state of Florida, it's a qualified medication aide or QMA. In some states, med aides can only administer specific medications or perform duties under strict supervision. All right, and so whenever you are going to be researching the med aid programs in your state, that's when you'll find out about your state's variation. So I'm not going to spend much time on that slide. So let's talk about the exam prep tips, because we're going to be going over some exam questions to help you understand your role and to help you better prepare for your experience when you are taking a med aid exam. So you're going to complete an approved training. study basic terminology or different medications. So we're going to discuss some of the common medications here, and I have a full video series that I'll be doing on medications within the next few weeks. Practice dose calculations. So go ahead and get your pencils and your paper, because you will have some calculations that we'll be performing during this live stream. And then understanding the documentation, familiarizing yourself with a MAR, reporting your errors, know your scope of practice, and then we're going to use practice tests such as this to help us succeed. So your job opportunities. Usually med aides do not work in hospitals. Med aides are going to be working in places that have a shortage of nurses. That's why we need you, because we don't have enough nurses to be given the medication. So those long-term care facilities, your assisted living facilities, your rehab facilities, sometimes adult care homes, that is where a med aide would usually be employed. All right, so want to learn more? You're going to go to your Board of Nursing's website for your state, or you can also give them a call or send an email, and you're going to be looking for the Med Aid program requirements and to see if they can refer you to a program in your area. All right, so here we go, team. I know you've been waiting for this. Question number 1. What is the primary role of a medication aide? Is it A, diagnose medical conditions, B, prescribe medications, C, administer medications under supervision, or D, perform advanced medical procedures? And we're going all the way to 50 questions. So good morning, good morning, good morning. All right, revealing the answer in 3, 2, and if you chose C, you are correct. Medication aides assist nurses by administering medications to patients under supervision. They are not authorized to diagnose or prescribe. Question number 2, we talked about giving medication safely and avoiding errors. Let's see what you know already. Which of the following is not part of the 6 rights of medication administration? Is it right route, right patient, right dose, or right cost? Which is not part of the 6 rights of medication administration? And I'll reveal the answer in 5, 4, 3, 2, and if you chose D, you are absolutely correct. All right, so let's talk about those rights, and I'm going to also put them in the chat. So the rights are right person, right medication, the right dose, the right time, the right route, the right reason, and the right documentation. So depending on your source, there are more than 6 rights, but I'm going to repeat that so you can write it down. You need to know the right person, right medication, the right dose, the right time, the right route, the right reason, and the right documentation. Question number 3, when administering a medication, what is the most reliable method of identifying a patient? A, asking their name, B, checking their wristband, C, asking their roommate, or D, looking at their room number? All right. Let's see what answers we have. And I'll be revealing the correct response in 3, 2, and that is right, Rosalie and Danita and Alicia. Great job. It is B. We're going to look at those patient wristbands because their room numbers may change, or you could have a person who's confused. So you just going up to Mrs. Lucille and saying, hey, is your name Betty? She's going to be like, yeah, because she has bouts of dementia, confusion, etc. So you are to look at that armband. And then for those facilities that don't usually have armbands on their patients, they will have a paper chart that has like a picture. And if you are unfamiliar, this is your first time ever being in this facility, the best rule of thumb is to get the nurse to confirm the identity of patients if they don't have their armband. And then you're always using 2 identifiers. So it's not just, hey, is your name Betsy Jones? It's like, can you tell me your name and also your date of birth? And you would verify that with the information that's on the MAR. And again, the MAR is the medication administration record. That's what we use to document the medications as we give them. Question number 4, which of the following is an example of a transdermal patch? Is it A, eye drops, B, inhaler, transdermal medication? Is it A, eye drops, B, inhaler, C, patch, or D, suppository? And I gave you that answer. I'm slipping this morning. So a transdermal medication is, of course, a patch. Okay, so it's going to be C. Transdermal medications are delivered through the skin, such as patches, and don't forget that it's not just going to be delivered through the patient's skin. If you put on a medication patch without gloves, you're going to be getting some of that medication too. So always make sure you use proper hand hygiene and to use gloves when you are administering medications. I know, Alicia, I gave out the answer. Question 5. A patient refuses their medication. What should you do next? A, force them to take it. B, try to convince them by arguing. C, skip the medication and move on. D, document the refusal and inform the nurse. Miss Nancy is not taking her Lasix today because it makes her pee and she doesn't want to be up on that toilet all day. She's missing the Price is Right. So what do you do? Reveal the answer in 5, 4, 3, 2. Yes, everybody got it right. It is D. You're going to document the refusal and inform the supervising nurse because that nurse maybe needs to go in and do some more teaching. All right. So we need to give you the Lasix because yes, it causes you to urinate, but you need that because your heart cannot take the excess fluid. So your nurse will go in and do some further teaching, and they will also show you how to document the refusal on the MAR. Question 6. Which class of drugs is commonly used to treat high blood pressure? Is it anticoagulants, antihypertensives, antidiabetics, or analgesics? And so as a medication aide, we expect you to know all these big terms and you have to pronunciate the medications correctly. And so one of the hardest medicines for me to actually pronounce when I was a young nurse was hydrochlorothiazide. And it was like every patient was on it because I worked on a heart unit. And so I would literally be outside of the door of a patient's room saying that word repeatedly, hydrochlorothiazide, hydrochlorothiazide. So when I walked in the room, I seemed more knowledgeable and I was not tripping over my words. So everybody, we know that for question 6, you may say it's your blood pressure pill, but the true term is B. It's an antihypertensive. So an antihypertensive lowers blood pressure, helping to prevent complications like stroke or heart disease. Make sure you take the blood pressure before you give an antihypertensive. If we don't have morning vitals, they probably should not be receiving their medications because if their blood pressures are already low and you give them an antihypertensive, guess what you just did to the blood pressure? You lowered it even further. So vital signs and then meds. Question number 7. Which of the following is a common side effect of opioids? Is it constipation, increased energy, diarrhea, or rash? And what a way to start a Monday morning with a practice test. I love you guys and gals. And so, Danita, you have it. You're the first one who gave the answer. It is constipation. Look, when you give someone an opioid, a pain medication, it slows everything down. It puts them to sleep and it puts their organs to sleep. So the intestines are not moving. They're in a relaxed state. And so opioids can cause constipation due to their effect on gastrointestinal motility. In other words, it ain't moving, it's just getting stuck there. So whenever, as a med tech, as a nurse, when someone wants their medications for pain, I usually get them to get up and walk first. Because once I give you your medication, you're not going to want to walk. You're going to go to sleep. So, all right, Miss Lucas, let's get you up. I know you say you want your pain medication, but at least let's walk you to the bathroom first so that I can make sure that once you're back in the bed, you won't have to get up for a few hours. But that helps me walk them, move them around, get their guts moving a little bit before I give them their dose of medication that they're asking for around the clock. Question number 8. A patient with diabetes is prescribed insulin. What is your responsibility as a medication aide regarding this medication? A, mix the insulin with water before giving it. B, check the patient's blood sugar levels. C, inform the nurse so they can administer the insulin. D, document the patient's insulin dose on their care plan. And remember, for this one, you're acting in the role of a med aide, not the role of the CNA. So your patient is prescribed insulin. That's the key term, insulin. What do you do? Yes, everybody, it is C. That is outside of your scope of practice. You don't give injectables. So you're going to inform the nurse so they can administer the insulin. I know it was tricky to check the blood sugar, but that's usually a CNA role. So remember, right now it's talking about something that's not even within your scope of practice. You cannot give injectables. So notifying that nurse was the best response. And here's our rationale. Medication aides are not authorized to administer injections, including insulins. Their role is to support nurses by ensuring proper documentation, notifying the nurse when medications like insulin need to be given, and monitoring the patients for signs of distress. If a patient is prescribed insulin, the medication aide should inform the nurse so the insulin can be administered. And it's okay, Richard, if you're pretty rusty, it's 7 a.m. in the morning. All right, so everybody, paper and pencil, or use your calculators on your phone. I need for you to convert grams to milligrams. And here's our question. Convert 2 grams to milligrams. Let's see if you remember your conversions. Go all the way back to high school for some of us, and for others of us, algebra. All right, so let's see. Let's do some conversions, revealing the answer in 10 seconds. 9, 8, 7. These are the slowest 10 seconds ever. 6, 5, 4, 3, 2, and so everybody, there are 1,000 milligrams in a gram. So in order to do your conversion, 2 grams would equal 2,000 milligrams. All right. So, and I see that some of you all got the answer correct. I'm proud that some of you tried. The other 20 of you were like, nah, it's too early in the morning, Nurse Eunice. We're not doing those conversions. But remember, write it down. 1 gram equals 1,000 milligrams. That's pretty easy to remember. All right. So we have another question number 10, because you want to be a medication aide. So that means that you have to learn some math. A medication label reads 250 milligrams per 5 mLs. How many milliliters are needed for a dose of 500 milligrams? Is it 1.5, 5, 10, or 20? Let's see, it's 250 and 5, and I need to give this patient 500 milligrams. How many milliliters, how many mLs do I give? And I'll give you 10 seconds. Let's see if you can get the answer right. 8, 5, and 1. So everybody, I want to teach you a little formula that we use. And the formula is D over H. So the dose that you have ordered over what you have on hand. So the dose that we have ordered was 500. What we have on hand is 250 times Q, times the quantity. So it'd be times 5. So if you did that on your calculator, you would come up with 10 mLs. So if there are 250 milligrams in 5 milliliters, and you need 500 milligrams, you would end up doubling the dose. So it'd be 10 milliliters total. And I want you, if you have your, I don't know if you're watching YouTube or this from your TV, but if so, just take a picture of this slide so that you can remember that formula, or you can just write the formula down, because that's going to help you answer so many of your calculations correctly. D over H times Q equals what you should be administering. All right, so true or false? Question number 11. After administering a patient's first dose of a new medication, the medication aide should monitor the patient for at least 10 minutes for any signs of an allergic reaction, such as swelling, rash, or difficulty breathing. What do you think, team? True or false? And now I'll reveal the answer in 5, 4, 3, 2, and I tricked you. It is false. It's not 10 minutes. That's not enough time. So, monitoring for 10 minutes is not sufficient to observe for potential signs of reactions such as swelling, rash, or difficulty breathing. Ensuring a longer monitoring period allows for a timely response to adverse effects. So you'll usually monitor, and it's not that you're in the room with them consistently for 60 minutes, but that once you start a new medication on a patient, you don't forget to go back and check on them. You just gave them a new medication for their blood pressure, and you don't check on them again for 8 hours. Well, their blood pressure could have dropped, or it may not work. So you have to go back and monitor these patients. So about every 15 minutes, just go back in and check on them. And then at the end, you would document medication given, no side effects, noted. Are they nauseated? Do they feel like they need to vomit? All of that would be important. If any of that occurs, you want to notify that to the nurse so that they can get advanced treatment. Question 12. In which setting are medication aides most commonly employed? And this one's easy. Is it assisted living facilities, hospitals, surgical suites, or psychiatric hospitals? Okay, and I'll reveal the answer in 3, 2, and yes, you have it. It is A, assisted living facilities. Remember, usually it's going to be a place that doesn't have enough licensed nurses, whether that's LPNs or registered nurses, because if they did, those nurses would be given the medications, not a medication aide. Question 13. Which law protects patient confidentiality and privacy? Another easy one. Is it the Patient Protection Act? Is it HIPAA, OSHA, or the Safe Staffing Act? And revealing the answer in 5, 4, 3, 2, and yes, it is HIPAA. It is B. And HIPAA stands for the Health Insurance Portability and Accountability Act. And that's where we get our confidentiality laws from. It ensures that patient health information remains private. Question 14. What should you do if you witness another aide giving medication without following proper protocol? Well, the nurse isn't available and she needs her insulin, so I'm just going to give the insulin. Do you A, ignore it, B, discuss it with the patient, C, report it to the supervising nurse, or D, administer the medication again? Yes, remember, even though you are staying within your scope of practice, sometimes people forget that they are not a nurse and they're going to be doing things that they shouldn't be doing, which jeopardize patient care. And so the correct response for 14 is going to be C. Report unsafe or improper medication administration to the supervising nurse, ensuring patient safety and upholds the ethical standards. Question 15. Which route of medication administration involves injecting medication directly into a muscle? Is it A, subcutaneous? Is it B, muscular? Is it C, intravenous? Or is it D, intramuscular? Let's give you a few moments and we'll reveal the correct response in 5 seconds. 4, 3, 2, and Yes, Danita, you have it right. It is D. Intramuscular or IM injections deliver medication deep into the muscle, often used for vaccines or pain medication. And Qualzem, you have it right also. And I know there can be a delay based on where you are viewing from. Sometimes YouTube shows the questions a little bit faster than some of the other platforms like Facebook. All right, question 16. Which type of medication is used to lower blood sugar levels? Is it anticoagulants, antipyretics, anti-diabetics, or antihistamines? So you're learning about your classifications of your different drugs. All right, revealing the answer in 5, 4, 3, 2, and fee and fur. Hope I pronounced that correctly. Alicia and Danita, you have it right. So it's not like I'm going to give you your diabetes pill because that's like you're giving someone diabetes. It's an anti-diabetic medication, such as insulin, glyburide, metformin. Glyburide and metformin are oral anti-diabetic agents. So not every diabetic is going to require an injectable such as insulin. Some can take pills. But those medications are used to lower blood sugar levels in diabetic patients. Question 17. What is the first step when receiving a new medication order? A, document it in the medication administration record, aka the MAR. B, administer the medication immediately. C, verify the order with the nurse. D, ask the patient if they want to take the medication. All right, so you just received an alert. Back in the day, it was a fax, but you just received an alert electronically, email. Hey, we have a new medication order. What are you going to do with it? Revealing the answer in 5, 4, 3, 2, and Charlene and Sandy, you have it. You need to go talk to the nurse just in case. So the answer is C. When receiving a new medication order, the first step is to verify the order with the nurse. This ensures that the order is accurate, complete, and appropriate for the patient. What if the nurse didn't even know the doctor ordered it and you walk in with a pill that the patient wasn't even expecting? Let the nurse be made aware first so that they can go back and follow up. Administering the medication immediately without verification could lead to serious errors, especially if the order contains a mistake. Question 18. When should medication administration be documented? A, at the end of the shift. B, during the next staff meeting. C, after the medication is administered. Or D, before administering the medication. So when do you want to document? All right, sorry about that. I had to open up my blind. I prefer natural light. All right, and so you all are absolutely correct. You want to document medication administration after you have given the medication. So it's going to be C. Medications must be documented immediately after administration to ensure accurate records. We have another math question. This one's easy. A physician orders 0.5 milligrams of a medication, and the tablets that are available are 1 milligram each. How many tablets would you administer? Would you administer 1 tablet, 0.5 tablet, 2 tablets, or none? Remember our equation. The ordered dose over what you have on hand times the quantity. Here the quantity would be 1. All right, revealing the answer in 5, 4, 3, 2, and yes, Qualzam, you got it. It is B. Since each tablet is 1 milligram, administering half a tablet, 0.5 milligrams fulfills the order. And here I have an image of a pill splitter. It would probably be best if they just had the pills in the correct in the correct dosage. But sometimes you'll see a device like this and some of the pills are already scored. So this would be an easier way for you to break a pill to ensure that it was scored evenly. Question 20, true or false? If a patient reports difficulty swallowing their medication, the medication aide should crush the pills and mix them with applesauce without consulting the nurse or checking the care plan. You're welcome, Alicia. What do you think is the safest for your patient? And that is right. We're getting the correct responses, everybody. That would be false because every medication should not be crushed. So some medications are time released or coated and should not be crushed. The medication aide must consult the nurse and check the care plan before altering how a medication is administered. This ensures the medication is given safely and effectively. So imagine if you crush a medication that is supposed to be um, absorbed or metabolized over an 8-hour period, but you just take it and crush it. So the patient gets the full effect of that medication in 30 minutes to 1 hour. So that's why you just don't go and randomly crush pills. You want to check with your nurse first. Or again, maybe the nurse should call the pharmacy or the doctor and request a different, maybe formula or a different type of medication. Question 21. What is the most common side effect of antibiotics? Is it rash, drowsiness, nausea and diarrhea, or high blood pressure? All right, revealing the answer in three, two, and yes, it is all of those GI issues. So it's going to be C. Antibiotics frequently cause gastrointestinal effects like nausea and diarrhea. Some, you make sure you read well. Some should not be taken with milk products. Some should not be taken with alcohol. So you want to make sure that you as a med aid provider know all of this and that you actually read those little pharmacy pamphlets or leaflets that they send with the medication, because you're going to be responsible for also educating and monitoring the patient for these side effects. Question 22, true or false? When a patient begins to show signs of hives and itching 15 minutes after taking a prescribed antibiotic, the medication aide should give the patient an antihistamine immediately to treat the allergic reaction. This one's tricky. True or false? And I'll give you 10 seconds to enter your comments in the chat. Almost everybody got it right. It is false, you all. Remember, you are not a nurse. So medication aides are not authorized to administer medications like antihistamines without a specific order and approval from a nurse or a healthcare provider. The appropriate action is to notify the nurse immediately and monitor for worsening of symptoms, because you all may be trying to give, let's say you're trying to give Benadryl, and the only thing that you would have access to would be a liquid form or maybe a pill. If you notify the nurse can get an order from a doctor to give IV medications, IV antihistamines, IV corticosteroids. So you want to include the nurse in that conversation so that we can make sure the patient gets the best treatment, the one that's going to work the fastest for their hives. Question 23. What is the best way to prevent medication errors? A, rely on memory. B, administer medications quickly. C, follow the 6 rights or however many rights there are of medication administration. D, ask patients for instructions. And this one's so easy. I'm only giving you 3 seconds, but it would be great if you all could try to recall the at least 6 rights of medication administration. So I'm revealing the answer in 5, 4, 3, 2, and yes, it is C. Adhering to the 6 rights: right patient, right medication, dose, route, time, documentation, and then the 7th will be reason. If you administer or if you adhere to those, that's going to help you minimize those errors. 24, why is it essential to observe patients during and after medication administration? And I know Alicia is going to have this one. Is it A, to ensure the medication is taken correctly? B, to monitor for adverse reactions or side effects? C, to ensure the medication is not misplaced or shared? D, all of the above. What do you think, team? Alhaji, Tico, Sandy, Danita, Jerlyn, Qualzim, Rosalie, Chrissy, what do you think? Yep, you all got it, because some of these patients will divert their medications. It will look as if they're swallowing it, and then they take it out from beneath their tongue and they will sell those narcotics. So the answer is D. Watching the patient during this process ensures their safety, avoids complications like choking, and guarantees the prescribed medication is administered properly. Question 25. Before giving a medication, you notice that the label is smudged and unreadable. What should you do? A, call the pharmacy and request a new label. B, administer it and document later. C, do not administer the medication and report it to the nurse. D, guess the medication based on past experiences. So when might this happen? When there's a liquid medication and you've been pouring the medication towards the label, and the medication has now gotten on the label. We've cleaned it off multiple times. So whenever you're pouring those liquid medications, do not pour towards the label area that shows the dosage, etc. Maybe pour the opposite way. And I hope that makes sense, so that it's going to be less likely to smudge the letters. All right, everybody, revealing the answer in 3, 2, and you got it right. I'm so proud of you. That one was an easy one for you all. It is going to be C. Medications with unclear labels should not be administered. Always report such issues to the nurse to ensure patient safety. And part of your Med Aide course, they're going to teach you not only how to read the prescriptions, but most of our prescriptions are now sent electronically directly to pharmacy. But the prescription or the order, and then also the label on the medications, which should include, of course, the pharmacy's name, information, the provider, the ordering doctor or nurse practitioner, their information should be on there, the patient's information, and also, without abbreviations, the actual directions. So for example, in this particular image, it says take 1 tablet by mouth every 12 hours. And then it gives you more information. Take the medication with food. This medication may cause drowsiness. So now you got to put your CNA cap on. And so if while you're in the room, this patient asks to use the bathroom, you're just not going to get her up quickly, because you're giving her medications that may cause drowsiness, that may cause her to become dizzy. So you have to put your whole, medication aid hat on, but also remember that you're still a CNA in some aspects, and that you're just not giving medication to a patient who's just going to lay there all day. They're going to get up. So the teachings that you actually provide do matter. Question 26, we're almost to 50, team. Why is it important to educate patients about their medications? A, to reduce medication errors. B, to prevent them from refusing medications. C, to eliminate the need for documentation. D, to improve compliance and understanding of the treatment plan. All right, let's see those responses. Revealing the answer in 3, 2, and of course, you all got it right. It is D. Educating patients enhances their understanding and compliance with the prescribed treatment. 27. Which of the following is an example of a medication error? A, administering a medication 15 minutes late. B, given the correct dose at the wrong time. C, verifying the medication label 3 times. D, documenting after administration. Which is a medication error? And I love it. It's so beautiful today. The birds are chirping. I think it's going to be 70 plus degrees in Florida. I do hope that winter hurry up and leaves. I miss the beach. I miss walking along the river, and I don't want to do it when it's cold outside. So everybody, revealing the answer in 3, 2, and it is B. Administering the correct dose at the wrong time is a medication error, and it should be avoided. So remember those rights. You have to give the medication at the right time. Question 28. Which of the following must be checked before administering digoxin? All right, so is it going to be blood glucose levels, respiratory rate, blood pressure, or apical pulse? And if you have pen and paper, I want you to write this down because you're going to be given this medication a lot. A lot of patients are on digoxin. All right, we'll give you 10 seconds to see if you can come up with the answer. What do you monitor before giving digoxin, and why? The whys are always important. And I see one correct answer. B has it. It is D, everybody. It is not blood pressure. Digoxin is not an antihypertensive. So the answer is D. Digoxin can slow the heart rate. So the apical pulse must be checked to ensure it is safe to administer it. So the apical pulse, when you look in the image, that is where you would place your stethoscope. So as a CNA, you would palpate the radial pulse for 1 full minute. But as someone who's given medications, somebody with advanced training, you need your little fancy stethoscope. Plus, you're going to be giving inhalers anyway. You're going to be giving people their asthma medications. So you're going to put the stethoscope on the chest where it shows in the image, and you're going to be listening to the heart rate for 60 seconds. Do not skip. Do not listen for 15 seconds and multiply by 4. Because if this patient's heart rate is lower than 60 and you give digoxin, which lowers the heart rate, you can cause your patient to have some immediate symptoms. And they can also become digitoxic, which can make their heart rate be slow for a prolonged period of time. So digoxin slows the heart rate. Question 29. A doctor orders 75 milligrams of a medication. The medication is supplied in 25 milligram tablets. How many tablets will you give? Is it 4, 3, 2, or 1? All right, I see some answers coming through. Let's see if we can get 2 more responses before we move forward. All right, I'm revealing the correct answer in 3, 2, and if you chose B, 3 tablets, you are correct. And so there is that formula again that I want you to take a picture of, or that I want you to write down. So divide the ordered dose, 75 milligrams, by the strength of 1 tablet, 25 milligrams, to determine the number of tablets. So 75 divided by 25 equals 3 tablets. Question number 30. Which of the following could be a sign of medication diversion? Someone is stealing medications. A, unexplained discrepancies in medication counts. B, frequent complaints. Oh, let's talk about medication counts. When you're giving out narcotics, usually at the beginning of your shift, you and the off-going med aide would count the number remaining. And then whenever you're leaving, the oncoming med aide, you and that person would do another count. And so unexplained discrepancies in medication counts. B, frequent complaints of loss or missing medications by a coworker. C, a coworker volunteering to administer controlled substances frequently. Or D, all of the above. And fun fact, you all, the Wegovy and all of those anti-diabetic medications that people are using for weight loss, And most of your facilities, now they're locking those down too. Those have to be controlled because somehow the medications are being diverted. Your nurses are getting thinner, but your patients' blood sugars are not being controlled because they're taking those medications and administering in themselves. At least that's what the reports say. So don't divert drugs. Yes, the answer is D, everybody. All of the above. Medication diversion can manifest in various ways, including unexplained discrepancies in medication counts, frequent complaints of missing medications. Oh, I dropped a pill again. Well, dang, Mary, you drop a pill every day. And unusual behavior, such as coworker frequently offering to administer controlled substances. These signs should be taken seriously and reported to a supervisor for further investigation. Recognizing these patterns is critical in preventing harm to patients and maintaining the integrity of healthcare practices. Yay! I hope you're as excited as I am. There is another medical math question. So a vial contains 100 milligrams of medication in 2 milliliters, 2 mLs. So 100 milligrams in 2 mLs. How many milliliters will you need to give if the dose is 50 milligrams? This is easy. Is it 1 milliliter, 1.25 milliliters, 1.5 milliliter, or D, 2 milliliters? So, all right, revealing the answer in 3, 2, and yes, Chrissy and Rosalie, you got it right. It is A. So to calculate, divide the dose needed 50 by the concentration, and that was 100 milligrams in 2 mL. So remember that D over H times Q? And if you do that, you're going to end up with 1 ml. So when would this pretty much come into play? When you're giving out pediatric medications, those liquid suspensions. So your pediatric syringes, those will have, like it may have like 0.5, 0.25. And so that's when pulling out the correct dose is really, really, really important, because you definitely don't want to be giving a child too much medication. And don't forget that as a qualified medication aide or a med tech, some of you all will be working in assisted living facilities. So you may, and group homes. So you may have to give medications to pediatric patients also. Just a thought. Question 32. What must you include when documenting medication administration? A, only the name of the patient. B, the patient's name and date of birth. C, the nurse's name and initial. Or D, the time, dose, route, and any observations. All right, revealing the answer in 3, 2, and it is D. Yes, Rosalie. Accurate documentation includes all of those things listed. Don't forget to include your initials on the MAR, and you will also have to sign at the bottom of the MAR. And so I know this is hard to see, but this is a sample MAR. It at the very top, this is where you would write in the resident's name, and usually you would include more information like their date of birth, maybe their medical record number. We would put a label there. Okay, just depends on where you are. If this is a brand new patient, you all don't have labels for them yet, you would handwrite it and then of course put a label on top whenever you receive the labels. And now the month/year, and then you would enter legibly. You would enter the medication in the box, put the entire doctor's order. Digoxin, 0.25 milligrams. You wouldn't put TID or QD or BID. You would write down exactly what it says, 1 time per day. And then hold if heart rate is less than 60. Everything the doctor put on the order, you would put in that medication box. And then for our morning medications, usually it's always going to be at either 6 a.m. or 9 a.m., depending on whether or not the medication needs to be taken with food or without food. And then, etc. So your facilities will teach you the time. And so this Initial MAR is what you would use, the one that's handwritten, up until the time that the pharmacy delivers the one that is computer generated. And a lot of your facilities, usually within 24 hours, you would have the computer generated MAR. So this would be a sample MAR. And at the very bottom, it would give you a place to sign and to also the legend. So if a patient maybe refuses the medication or if something's late, you would know what to put in the box. Because if you initial it, that means that you gave it. All right, so question 33. Why is it important to check a patient's gag reflex before giving medications? A, to ensure the patient is alert and oriented. B, to determine if the medication should be crushed. C, to check for an allergic reaction to the medication. Or D, to prevent choking or aspiration. Why do you check the gag reflex? All right, revealing the answer in 5, 4, 3, 2, and yes, it is D, to prevent choking or aspiration. Look, you've never worked with this patient before. You're going in there and they're kind of stuporous. They're barely talking to you. The previous med aide says, yes, I gave her medication without any issue. You're going to sit her upright and be like, okay, let's verify your identity, blah, blah, blah. You're going to get a tongue depressor and you're going to say, all right, let's say ah, and you're going to stick that tongue depressor. You're not trying to make them gag. You're not trying to be mean with it, but you're going to stick it as far back into the back of their throat as they can tolerate. If that person moves, or if they say, oh, that means that they have a gag reflex. If there is no movement, if the patient is letting you be back there in the back of their throat and, they're unconcerned, that would be a cause of alarm. So checking the patient's gag reflex ensures that they can swallow safely without the risk of choking or aspiration. If the gag reflex is weak or absent, the patient may not be able to protect their airway, which could cause serious complications such as aspiration. Notify your nurse. Question 34. Which of the following is an example of a medication aide working outside of their scope of practice? A, administering oral medications. B, changing a resident's care plan. C, documenting medication administration. D, reporting medication side effects to a nurse. Which is outside of your scope of practice? All right, revealing the answer in 3, 2, and that is correct. You have it there. You cannot change or modify the care plan. That is done by nurses and doctors. You can add your information to it. You can add updates, but you are not responsible for initiating or changing the care plan. Question 35. What should a medication aide do if a medication drops on the floor during administration? A, pick it up, clean it, and give it to the patient. B, discard the medication and document the incident. C, inform the nurse and request a replacement dose. D, both B and C. All right, I'm seeing some varying answers coming through. Let's see if we can get 2 more responses. Yes, let's see. Chrissy, Vadim, Elvianes, and Danita, you have it. It is D. It is both B and C. So if a medication drops on the floor, it must be discarded to prevent contamination and potential harm to the patient. But especially if it's a narcotic or a high-risk medication, you're going to discard that in the presence of a nurse. The medication aide should document the incident and inform the nurse to obtain a replacement dose, ensuring the patient receives the correct medication safely. Administering a dropped medication is never appropriate. So we don't do the 3-second rule in healthcare. If a pill touches the floor, we're going to discard it. Question 36. A patient taking anticoagulants like warfarin should avoid which of the following? A, foods high in vitamin K. B, dairy products. C, foods high in protein. Or D, water. And this is encouraging me. It's exciting me to do that video on medications, because if you don't know what warfarin is, you're going to add that to your little notes. I'm having you take notes today with formulas, with different medications. Warfarin is also known as Coumadin. So if someone's taking Coumadin, what should they avoid? Revealing the answer in 3, 2, and Sandy, Chrissy, and Elvia, you all have it. It is A. They have to avoid those green leafy vegetables because they are high in vitamin K, and those would counteract the effects of anticoagulants. So anticoagulant makes it so that your blood is thinner, so it can flow to those vessels, so we can prevent strokes, etc. But if you start eating a whole bunch of collard greens and spinach and you haven't been doing that before, well, vitamin K causes you to clot. So it's going to counter the effects of the medication that we're giving you in order to help save your life, to prevent a future stroke, to prevent blood clots. Question 37. How should a medication aide document a patient's refusal of medication on the medication administration record? A, leave the section blank to avoid confusion. B, cross out the medication entry for that time. C, write to refused in the comment section and notify the nurse. D, document the refusal in the patient's medical record only. All right. Revealing the answer in 3, 2, and it is C. Great job for you all who chose C. So usually there's a legend where maybe like R means refused. They're going to show you what to put in that box, but you never want to leave a box blank. So when a patient refuses a medication, it must be documented on the MAR to ensure accurate record keeping. Writing refused in the appropriate section and notifying the nurse allows the healthcare team to address the patient's concerns or needs and make adjustments to the care plan if necessary. Leaving a section blank or crossing it out can lead to confusion and errors in patient, let's see what that says, patient care. Question 38. And if you've been with us this far and you haven't liked the video or subscribed to our channel, please go ahead and do so. All right, we appreciate you all so much. So question 38. A patient is receiving dialysis at the scheduled time for their medication. What should the medication aide do? And how much time do they have to administer the missed dose after dialysis? Is it A, skip the dose entirely and continue with the next scheduled dose? B, administer the dose immediately after dialysis and document the time? C, notify the nurse and follow the facility policy, which may allow administration within a specified time frame? Or D, administer the medication at the next meal to make up for the missed dose? So this patient was in dialysis. They missed their scheduled dose of medication. What is the safest thing to do? Revealing the answer in 5, 4, 3, 2, and I am so proud of you all. You make my heart smile. You all gave me the right information. I am so proud of you. So yes, everybody, it is C. When a patient is unavailable for a scheduled medication due to dialysis or whatever, maybe they're having a medical intervention, the medication aide must notify the nurse and follow the facility's policy regarding the missed dose. Many facilities have a grace period, commonly an hour before, an hour after. So if a medication is due at 8, but if you give it between 7 and 9, you're good. So during which the missed medication can be administered, but this depends on the type of medication and the patient's condition. The nurse will provide guidance to ensure the medication is safely given when appropriate. Skipping the dose entirely or deciding on timing without consulting the dose, without consulting the nurse, can lead to errors or harm to the patient. And as a nurse, I would simply follow the facility guidelines And if there aren't any that addresses that specific medication, I would give a quick call to the doctor and get an order to give the medication or to hold the medication. Question 39. What is the first step in preparing to administer medications? A, check the physician's order. B, wash your hands. C, identify the patient. Or D, gather the medications. When you're taking these tests, always think about safety. What is the safest first step in preparing to administer medications? All right, revealing the answer in 5, 4, 3, 2, and I see a lot of you all have your CNA hats on. Remember, you are now giving medications to a person. So while washing your hands is important, check the physician's order. Yes, that is the safest thing to do. So the first step in medication administration is to check the physician's order to verify the correct medication, dose, route, time, and patient. This ensures the medication aide is following the provider's instructions and prevents errors. Washing hands, gathering medications, and identifying the patient are essential subsequent steps, but they occur after confirming the order is accurate and appropriate. Administering the medication without verifying the order first could lead to significant errors and harm to the patient. So once the order has been confirmed, then yes, the first step will be hand washing. But, just make sure if there's ever a test question that mentions checking the doctor's order, that would be my first step. And for some places, it may not be a doctor's order. It could be the physical prescription that was sent from the doctor. Yes, you can, Danita. Question 40. You notice that a patient is unable to swallow their oral tablet. What should you do? A, crush the tablet. B, skip the dose and document it. C, consult the nurse to adjust the medication form. D, dissolve it in water immediately. And I know that you all know this answer because we've already talked about it. So I'm revealing the answer in 3, 2, and we're going to do C. You got it, Rosalie and Al-Haji. You have it. So only the nurse or prescriber can authorize changes to the medication form. And so I have here 2 different types of pill crushers. You must have approval to crush a pill to alter its form, because if a pill needs to be crushed, more than likely that patient needs a whole different formulation. Maybe they need a liquid, a suspension. So if you are able to crush a pill, the smaller one is the more silent one, the little twisty one. You just twist, 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 crush the pill. You still have to keep the pill separate. You can't crush 20 pills and put them all in one cup because they could cause a reaction. So even if you're crushing pills, you still have to give them individually. The bigger one, the one that says Silent Night, oh, that's the stress reliever right there. You just crush it, crush it, crush it, crush it. All right, I'm enjoying that too much. But yeah, so depending on what facility you're in, you may have either of these pill crushers. But again, we don't crush everything. And then once it is crushed, we don't mix it all together because we don't want our patients having an upset stomach. Question 41. What is the first action to take if you realize you have given a patient the wrong medication? A, inform the patient about the error. B, document the error immediately. C, report the error to the supervising nurse. D, try to correct the error by giving the correct medication. Let's see what answers we have. Revealing a response in 3, 2, and Dernita, Jerlyn, Rosalie, Chrissy, you have it. Notify that nurse. It is C. Medication errors must be reported to the supervising nurse immediately to ensure patient safety and proper corrective action. Question 42. Why is it inappropriate to mix crushed medications into an entire container of applesauce? A, mixing medication with food is never allowed. B, the medication's effectiveness may be reduced when mixed with applesauce. C, it violates infection control protocols. Or D, the patient may not consume the entire portion, leading to an incomplete dose. Got to put your thinking caps on for this one. I know what you want to do, but what you want to do is not always the correct thing to do. So are you going to open the lid on the applesauce container and pour your crushed medication into that entire container of applesauce? No, you're not, because Qualzam, Luigi, Chrissy looks like they have the right answer. Because if you do that and they don't eat that entire cup of applesauce, it's going to be D. They may not consume or get enough of their medication. So what do we do instead? We have a medication cup that we put applesauce in, a little small medication cup. We put applesauce in that and then mix their pills in that. And with 1 or 2 bites of food, swallows, they're going to take all of their medication with a smaller portion of applesauce. That way they have their entire container of applesauce later to enjoy. So crushing medication and mixing it into an entire container of applesauce can result in the patient not consuming the full dose, which may reduce the medication's effectiveness. It is essential to mix the crushed medication with only a small, manageable portion to ensure the patient receives the correct dose. While mixing medications with certain foods like applesauce is allowed when appropriate, it must be done in a way to ensure the full dose is administered. The same way when you're giving medication to a baby. You don't put the whole, the entire dose of medication in a huge baby bottle, 8 ounces. The baby may not drink all of that at one time. So you would instead take a smaller amount, maybe just like the very top, the nipple of the bottle, and you would put a little bit of the milk in that mixed with the medication. So when the baby sucks, immediately the medication and the milk goes down. All right, so question number 43. When administering eye drops, what is the correct technique to avoid contamination? Remember, you all can do oral, you can give ear medications, eye medications, topical medications. So when you're giving eye drops, do you want to do A, touch the tip of the dropper to the patient's eye for accuracy? B, rest the dropper on the patient's cheek to steady it? C, hold the dropper above the eye without letting it touch any surface? Or D, apply eye drops to both eyes just in case the infection spreads. I know what you do at home. But those patients are not your kids. So what do you do? What's the correct response? And so for those of you all who chose C, not B or D, you have it. So you don't want that dropper touching the patient's eye. It's going to get contaminated. And you don't just want to be creating your own orders. If the doctor has ordered that this medication is given in the right eye, you don't want to be like, hey, let me just go ahead and put some in the left eye also, just because. So the dropper must not come into contact with the eye, eyelashes, or any surface to avoid contamination and reduce the risk of infection. Proper technique ensures patient safety and maintains the sterility of the medication. Question 44. What should you do if a patient questions the medications you're about to administer? Get an attitude. That's what y'all like to do. Just joking. Don't do that. A, ignore their concerns and administer the medication. B, double check the medication and order before administering it. C, ask the patient to consult the doctor. D, explain that patients cannot question prescribed treatments. All right, so you are a CNA for 3 years, and now you've been a qualified medication aide for 2 days. And Miss Lucille is questioning the medication. It does not look like her regular pills. What do you think the best response is? Yes, Al-Haji. Yes, it is B. Patients have the right to question their treatment. Double checking ensures accuracy and builds trust because sometimes the manufacturer, the distributor, may not, let's say last time we're getting our medications from company A. But this month we had to get these medications from company B because of insurance reasons, what have you. And company B's, even though it's the same medication, the same formulation, the pill is shaped differently and it's a different color. These patients are creatures of habit. So if they have a question regarding their medication, answer their question. Be respectful because they could, number one, catch a medical error that maybe the pharmacy sent the wrong medication, or two, you'd be able to educate them and tell them the reason why the pill looks different is because we switched to another supplier. Question 45. What should a medication aide do if they encounter an illegible medication order? You can't read it, sloppy handwriting. A, guess the medication dose based on the patient's previous orders. B, administer the most likely medication to avoid delays. C, skip the dose and document that the order was unclear. D, notify the nurse or supervisor to clarify the order. And I'm revealing the answer in 5, 4, 3, 2, and yep, D's the safest answer. Notify the nurse so she can contact their provider. Hey, Dr. Jenkins, you wrote an order. I can't read it. Can you please clarify this order for me? So if the medication order is illegible, the medication aide must notify the nurse. Administering medication without understanding the order could lead to serious errors and harm to the patient. Guessing or skipping the dose without clarification is unsafe and violates medication administration policies. Ensuring clarity before proceeding protects both the patient and the healthcare provider. Don't forget, you're giving medications. Not only can you be sued, you can go to jail. So make sure you understand what you are giving before you give it. Question 46. What is the correct way to administer eardrops to an adult patient? A, pull the ear upward and back to straighten the ear canal. B, pull the earlobe downward and administer the drops. C, place the drops in the ear and have the patient sit upright immediately. Or D, administer the drops and clean the ear canal with a cotton swab. Oh, you all have me so encouraged. Maybe I should teach med aid classes again. I stopped teaching them because I teach so much, but who knows? Who knows what 2025 will hold? All right, everybody, revealing the answer in 5, 4, 3, 2, and it was A. All right, so let's talk about it. For adults, you pull the ear up and back. For pediatric patients, you pull the ear down. So for adults, pulling the ear upward and back helps straighten the ear canal, allowing the medication to reach the intended areas. After administering the drops, the patient should remain in a tilted position for a few minutes to ensure proper absorption. So you just don't have them sit up immediately. Using cotton swabs in the ear can push debris further in and is not recommended. Question 47. What is a common condition treated with buccal medications? Is it tooth decay, angina or chest pain, also referred to as angina, skin infections, or sinus congestion, which I have right now? So, buccal medications, what in the heck does that even mean? But as a medication aide, you can give it, so you have to know. Revealing the correct response in 7 seconds. 7, 6, 5, 4, 3, 2, and drumline, please. If you said B, you got it right. So great job there, Chris C. and Elvia Niz. So buccal medications like nitroglycerin tablets are placed between the cheek and the gum. They can also sublingual, could go under the tongue to quickly relieve chest pain caused by angina. So those are not something that needs to be swallowed. They're going to be placed in the cheek or under the tongue and absorb quickly into the bloodstream that way. Question 48. Which condition is typically treated with topical antifungal medications? All right, so you all, I need to just take a quick pause to say, congratulations, Rachel. I am so proud of you. All right, so everybody, if you have a time, would you please say congratulations to Rachel? All right, so question 48, which condition is typically treated with topical antifungal medications? Is it eczema, bacterial infections, seasonal allergies, or athlete's foot? Did you all know that a medication aide could do all of this without going to college, without being a nurse? Yes, you take a 40-hour class, a 60-hour class, depending on where you are in the country, and you could be certified to give medications. Usually requires 1 year of experience as a CNA first. And so if you chose D, yes, you get to play with your patient's footsies and you get to put on some gloves and apply the antifungal creams that are used to treat athlete's foot, etc. on their body. You have been elevated. Welcome to the team. Question 49. Which type of medication is commonly used to treat asthma? Is it A, oral antibiotics, B, nasal decongestants, C, inhaled bronchodilators, or D, topical analgesics? Revealing the answer in 5, 4, 3, 2, and you have it correct there. Oh, Haji, where are you viewing from? Because your answers are coming first. So I think it just depends on where you're watching from, and you won't have such a delay. But for all of you all who used inhaled bronchodilators, aka their asthma pump, you're absolutely correct. So it is C. The bronchodilators relax the muscles around the airways, making it easier for patients with asthma to breathe. Question 50. A patient has a wound that requires local pain relief. Local is the key word. Which type of medication would be most appropriate? All right, Al Haji in New York. Is it A, oral analgesic tablets, B, topical anesthetic cream, C, nasal spray, or D, buccal tablets? Revealing the answer in 5, 4, 3, 2, and no answers are coming through yet. Let's give you a few more moments. Looks like Rosalie and Danita, you have it, because if it's local, we're going directly to the source. We're not going to give them a pill that has to be metabolized and digested. Where if you're having pain in a certain spot, we're going to put the numbing ointment right there on that spot. So when you think of topical anesthetics, think of lidocaine, xylocaine, whatever it is. Some are available over the counter. Some, of course, would be prescription based. But topical anesthetic creams are applied directly to the skin to provide localized pain relief. And as I've already said, if you are doing anything that involves the skin, whether it's a transdermal patch or a cream, make sure you have on lotion. Otherwise, have on gloves. Otherwise, it's also getting absorbed into your skin. So I'm going to hang around for a few minutes. I am so proud of you all. I am giving you all long distance hugs from Jacksonville, Florida. So thank you all for watching. I appreciate you all so much. And I know that Danita had a question. So Danita, go ahead and put your question in the chat. And if any of you all have video ideals, I don't have a video for my intern to create today. So if you give me a good idea, I will shoot that over to her so she can create the presentation. All right. You're so welcome. It's so great having you here. Oh, I appreciate you all. All right, let's see what question Danita had. Danita, you said you had a question for me. All right, so Danita's question is, where is Ensure kept in a nursing care facility? Usually it's kept in the pantry. And that's if some of your facilities will have like a storage area. So it's in the cabinet, and that's where those supplemental beverages are usually kept. Sometimes they deliver them directly into the patient's room. So the way that it usually goes is these have to be prescribed. Ensure, what's the other one? Boost, they're prescribed. They go directly to a patient. But let's say the patient's on isolation or something, and the dietitian won't deliver that into the room. They leave it outside the room, and you, as the CNA, you're supposed to take it in. Well, sometimes they get diverted to the nourishment room, to the pantry. So I'm not sure in context, like was this on a test or something, but it's either going to be sent directly to their room, or they're going to store the excess in a pantry or a nourishment area. So I hope that helps to answer your question. All right. No problem. No problem. I hope that you understand it now. And so, oh, good luck on your exam today. We are praying for you. And Rosalie, no problem. You want to learn more about medications. I got you. All right, everybody. You all have a phenomenal Monday. I'm going to be back on later with some crazy videos I need to post, but I will come back tomorrow with another either CNA or QMA, Qualified Medication Aide video. So I appreciate you all. God bless you. And I'll see you in the next video. Bye, everybody. And thank you for watching, Veronica.